Hernia is an opening due to the weakness in muscles or tissue that contains it. It normally appears in the abdomen, groin, or in other words, a hernia occurs when a fatty tissue squeezes through a weak muscles called fascia. Types. There are different types of hernia. Some of them are as inguinal hernias, also known as groin hernias, are most common of all hernias. An inguinal hernia can contain a portion of the small intestine or parts of the female reproductive organs. 75% of hernias are inguinal hernias. They mostly affect men or people assigned male at birth. They occur when the intestines push through a weak spot or tear in the lower abdominal wall, often in the inguinal canal. Inguinal hernia can be an indirect inguinal hernia, occurs in inguinal ring from the top. Normally occurs due to birth defect, as in some cases opening to the canal doesn't close. Direct inguinal hernia. This type of hernia develops in adults. This normally happens due to the weakening abdominal muscles and pressure on the muscle wall. Femoral hernias, groin hernias, they are common in women but can occur in men. A femoral hernia occurs when tissue passes through a weak opening in the groin or inner thigh. Women experience femoral hernias more often than men due to the larger width of the female pelvis. They can sometimes be linked to straining during bowel movements or lifting heavy weights. A femoral hernia can also be a cause for concern as femoral artery and vein is nearby. It may be possible that the hernia could affect these blood vessels and block blood flow in the leg. That is the reason that doctors try to quickly correct a femoral hernia with surgery. Hiatal hernia is also common type of hernia. It occurs when opening in diaphragm widens and the top of stomach pushes up through the opening into chest. This type of hernia is common in people over 50 years old. If a child has the condition, it's typically caused by a congenital birth irregularity. These hernias cause reflux of acid, GERD, from the stomach into the esophagus, which can lead to heartburn, pain, and erosion of the esophagus. Ventral hernia happens when tissue bulges through an opening in the muscles of abdomen. Ventral means part of body around belly area. Ventral hernia may be as epigastric hernia, umbilical hernia, incisional hernia. Epigastric hernias are bulges that occur in the part of abdomen, epigastrium, that lies in between the breast bone and the belly button. They are caused by fat and breaks through a weakness in the abdominal wall between the umbilicus and the breastbone. Umbilical hernia is most common in newborns, but can also happen to adults. They occur when the intestines bulge through the abdominal wall near the belly button. These hernias may just after birth and may resolve after couple of years. However, the area of weakness can continue throughout life and can occur at any time. In adults, umbilical hernias will not resolve and may progressively worsen over time. They are sometimes caused by abdominal pressure due to being overweight, excessive coughing, or pregnancy, etc. Incisional hernia can result from surgical scarring or weakness of the abdominal muscles at the surgical site. It is most common side effect of abdominal surgery. Perineal hernia involves the pelvic floor, perineum. It occurs when organs or tissue push through weak area in pelvic floor into abdominal cavity. These can occur in humans, dogs and mammals. These hernias are very rare. To be continued. Thank you for watching my video. For more videos kindly like, share and subscribe.